This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA, PRA, Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
So I was going to present a tox case from the other day, use it as sort of a springboard to talk about general toxicological principles, ER management, and then also some specifics as it has to do with this case. So it was a young female came in with a known ingestion in an attempted suicide. The story, very reliable, was no history of suicide attempts in the past, being treated for bipolar, takes a single medication, lithium, and overdosed on a 1-month supply of lithium. It was sort of an attempt where she didn't communicate to anyone. Her boyfriend discovered the empty pill bottle and so activated EMS. So she came in about an hour and 15, hour and 20 minutes after the ingestion. So we're going to talk a little bit about lithium toxicity and the treatment protocols and the diagnostic protocols, and then also general toxicologic principles. So in terms of general tox principles, what are sort of our priorities? The priorities are always sort of ABCs, but with respect to an ingestion, we want to get a reliable history. And then, the treatment revolves around decontaminating the patient, limiting any absorption or enhancing elimination, and then identifying whether or not there's any antidote to treat beyond supportive care. So against that paradigm, in terms of a significant ingestion like this, it ends up that the lethal dose of lithium that you can take is about 700 milligrams per kilogram. That was near what she ended up taking. Okay, so it was considered a potentially lethal ingestion. As far as treatment, what are the things that we want to do to consider limiting absorption or enhancing elimination immediately? Yeah, so sometimes, if it's within an hour, and I haven't seen this done in several years, but it's a large bore tube and try and irrigate the abdomen, pill fragments. So this was not within an hour, but other aspect of GI decontamination would be whole bowel irrigation. This was not done in this particular case, but it was a judgment call. The patients get 1 or 2 liters of Go Lightly hourly until the effluent or it's clear. So it generally takes 2-3 hours. For her, do you guys know how we assess the severity of the ingestion, other than sort of the reported history and what the treatment is? Blood lithium level, right? Yeah, and so therapeutic is up to something like 1.6, 1.8. It ends up that anything above 2 is significant toxicity. Above 4 indicates you for the life-saving treatment, which she ended up getting. Her initial level was not above 4, but lithium can have a delayed absorption. Her level goes above 4, and so she got what? Dialysis. So she had a dialysis catheter placed, and she got dialyzed. As far as sort of the natural history, her presentation, they get gastrointestinal symptoms, they can get neurologic symptoms and cardiovascular symptoms. For her, during her course, she started getting temporarily gastrointestinal symptoms, nausea, vomiting. She started to have tremor and some nystagmus and some confusion. And then her EKG had some flip T's. So she had a very classic progression. We checked the levels indicated dialysis, and she got the life-saving intervention. So hopefully that gives you a sense a little bit about how we approach general tox cases, and in this particular case, a highly lethal or potentially lethal ingestion that ended up having a relatively easy save.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.